in terms of the way the Affordable Care Act increases access, obviously you have a whole bunch of big things that kids get covered up to the age of 26, not 18, Medicaid expansion, the exchanges and so forth. So given some of the problems, like states have refused to actually allow Medicaid to expand, how, in terms of access, how big is the improvement we have now and are going to have over whatever it was we had before?
So that states are refusing, I think, is a surprise to us. The deal in the Affordable Care Act for states is really sweet. Federal government picks up 100% of the fee, and it drops down to 90% of the Medicaid expansion towards the end of the decade. You know, it's like, this is a great deal for you, first of all. Second of all, so we didn't see that coming at all. I would say, and I make a prediction in my book, that I think all the states will be on board by 2020. One of the things most people don't realize is when Medicaid was passed in 1965, it took to 1982 for the last state, Arizona, to adopt Medicaid. So, got to have a little...
Arizona's kind of a late adopter on a number of things, aren't they?
Got to have a little patience here. But I think they're going to come on largely because their hospitals want it, and they're going to figure out this deal of putting people, if we're not going to expand Medicaid directly, putting them into the exchanges with protections, I think is going to look appealing to conservatives. Notice how the exchanges become to look appealing to Republicans. And so I think you're going to have a lot of that, you know, Pennsylvania, for example, Governor Corbett is trying to negotiate that now. So I think you're going to have a big blossoming of interest, especially because the deal is good. Once we get past the 2014 election and all the hullabaloo, it's going to, I think the politics is going to die down on this. And so
you have said that you're an optimist, though.
Yeah. I think the exchanges, you know, the fact that we got 8 million people after the 2 months of utter, you know, problems with it and not really being able to use it suggests there is a very large appetite for affordable coverage in this country. And the reason people haven't been insured is exactly what we hypothesized. Couldn't afford it. And so you give them a mechanism where they can afford it and subsidies for people who are under 400% of poverty, you know, they're going to go out and buy it. So I actually anticipate this is going to grow much bigger than the Congressional Budget Office
thinks. Is the question of penalizing people who don't get coverage going to just wither away because that's going to be a trivial part of
No, it's not going to be trivial. It's not going to be trivial, but it is. I think it's going to become much less important. The latest data, actually, I think there was a study released either yesterday or today saying that the penalties did seem to play a role in people's thinking, and I think going forward, it'll play some role in people's...
Do the penalties exist now? I thought they hadn't yet.
No.
They're
the
already
penalties,
there.
Well, people haven't paid the penalties, but that they would be penalized
I see.
is, I think, changing people's attitudes. And I think, you know, you do have to have some kind of penalty, especially for young people. But, you know, I'll just give you my personal story. I was in early March in Aspen, Colorado, and renting some skis, and a guy who's helping me behind is hobbling around, hurt his shin and I said, so do you have health insurance? No. I said, all right, when I come back this afternoon, we're going on the Colorado Exchange website, and we're going to buy insurance.
Guy, wow.
But what was interesting, no, it wasn't. It turned out not to be just one. So he's got them up. He's comparing them. You know, this one's got insurance. This one's got dental care for an added $10, and you know, he's doing exactly what the exchange is supposed to do: comparative shopping, figuring it out. He's getting his. So I asked him. I said, look, I don't want to pry. How much are you making? He says, I make about $27,000 a year. You know, not a whole lot of dough in Aspen. And you know, he got a reasonably good subsidy, but Aspen's a very expensive city because everyone else in Aspen has a lot of money, and it's a very expensive insurance market. But he got something, I forget exactly, you know, 150, 175 in that range. Now he's sitting there. There are 4 other workers, and you know, the guy who owns the shop is like, he's 40 plus years old. Really, how much was that? Now, and he begins to say, well, maybe I should give up my plan and go shop there.
Oh my God, it's the commercial. It's the Obamacare commercial.
I don't think this is unique.
Yeah.
I don't think this is unique. You know, I've been driving around, talking to everyone when they find out I know something about this. You know, some driver in New Jersey said to me, you know, he's 57 or 8 years old. He and his wife were paying some exorbitant $18,000. He went onto the New Jersey exchange. He saved about $4,000, you know, and he was like, it's real money to him. So I think you're going to get a lot more of this and a lot more interest. And once, again, all the politics, people become used to shopping on the exchange, I think people are going to like it.